A patient today asked about treatment for their OCD. Specifically, they were frustrated that they have been on a very high dose of Luvox, which is fluvoxamine, traditionally your main SSRI or your most potent SSRI for treating obsessive compulsive disorder, at a full dose, so 300 milligrams plus, for a full trial, 2 to 3 months. They said that their OCD had gotten significantly better, about 80% better, but they were still struggling. And because they had been on many different trials in the past, they were starting to feel like really nothing was fully going to alleviate their symptoms, or nothing was going to really cause them to have lower distress than the point that they were at. And again, they were feeling 80% better, but they still were having some difficulty with obsessive thoughts that were rather upsetting to them and distressing when they thought about them. So one of the things that we talked about was adding a medication called Clomipramine to their Luvox. Now, as mentioned, Luvox or fluvoxamine is an SSRI. Clomipramine is an older antidepressant. It's called a tricyclic antidepressant, or a TCA. TCAs came about in the 1950s. So they're medications that have been around a lot longer than your SSRIs, like Luvox or like Prozac or Zoloft or Lexapro or Celexa. TCAs can be extremely effective in treating depression and anxiety disorders and other types of psychiatric illness. However, in general, mental health professionals will utilize your SSRIs and your SNRIs a lot more often because tricyclic antidepressants can have a higher propensity for more significant side effects, and actually, if taken in overdose, they can be lethal. So tricyclic antidepressants can change someone's heart rhythm when taken in overdose and can cause death. And so that's one of the reasons why they're not used as much. They also tend to have more side effects like real significant dry mouth, constipation, urinary retention, orthostatic hypotension. So when you stand up too fast, you might feel a little bit dizzy or lightheaded as your body adjusts to the medication. With all that being said, Clomipramine is a very serotonergic medication, and sometimes under a physician's care, and really you want to see a mental health professional that does this type of treatment, a small amount of Clomipramine can be added to Luvox or fluvoxamine. And I've done this in patients where they have an 80 or 85% response to a higher end dose of an SSRI. We may add a very small amount of Clomipramine and find that the symptoms really come down substantially, and then that person really has alleviation of significant distress for their illness. With any treatment for OCD, I always recommend psychotherapy and cognitive behavioral therapy, specifically exposure therapy to those thoughts or to those compulsions, or not doing those compulsions as well. And again, these types of videos about specific forms or ways to treat psychiatric illness, they are informative only. They're not meant to be medical advice for any individual out there. So make sure that if you believe that this video pertains to you in any way or could pertain to you in any way, that you talk to a mental health professional to discuss setting up an appointment.